bad having morning sessions in New York City. Everybody has their own night plan. We had a very excellent meeting some weeks ago with Larry Merlo, who is the Chief Executive Officer, right?
Yes, he is.
Of the new CVS Aetna relationship. Because the weather yesterday, he could not fly down here and not get here on time this morning, so he sent his executive VP in charge of all things, Thomas Molarity. And Tom, explain a bit the area that you cover.
So I am now responsible for what we call external affairs. So all of our government relations, policy, community relations areas, working very closely with David Casey and his team and others in the company, Reverend. I'm also the general counsel. I shouldn't leave that out too. So.
You were once seen as a kind of retailer that's happened to have a pharmacy. Now you've taken the whole healthcare industry. What does explain that?
Sure. So we've been on a journey the last probably 7 to 10 years where we've seen healthcare as becoming much more consumer-centric and local. And so over the last several years, we've taken a number of steps to become even more local. We're in roughly 10,000 communities across the country. And the latest sort of step in this is the merger with Aetna, because as we see what I call a decentralization on access to healthcare, moving away from systems into communities, the ability to look at things like social determinants, the ability to have models that can go local and provide that access to care. The Aetna model, along with our community touch points, I think is going to make a real difference in that.
You have nearly 10,000 stores now.
We do, sir. Yeah.
How do you deal with the unique dimensions of those communities?
It is. So we have
in the city and suburban type.
Across the board, yeah. We're across pretty much every community across the country here. And I think it's a great question because obviously, like politics, healthcare and communities are very local. They look and they take the shape of the folks who are resident there. And as we go into communities, we not only look to replicate within our stores itself, but be very aware of that local feature. And one of the things, David and I have talked about is we made an acquisition down in Miami several years ago of a Hispanic Cuban pharmacy called Navarro. And what we learned from that is how, when you focus on the communities, the difference you can make. And the learnings we have from that has really been able to take it to other Hispanic communities and into other communities across the country to make that access to care really local.
You brought CVS together with Aetna. That's an interesting combination. Yet it's the same family of work.
It is. So we've had about a 7-year relationship with Aetna before the merger. So we've gotten to know each other pretty well, how we work together. And again, I think what the model can deliver, just some facts for the room, for the folks here, that's really important to keep in mind. Healthcare today in the United States represents 18% or so of our gross domestic product. It's estimated over the next several years to grow to 20%. That additional 2 points of growth is $250 billion that's not going to be available for education, for investment in infrastructure, and other key areas that we need to do as a nation. So how we manage our health care, not by restricting access, not by limiting care, but looking at how we use our dollars more efficiently, and again, push that care local, that's what this combination's about.
How does this drive toward universal Medicare, what does it mean to you?
It's a great question. I think Medicare Part D is a great example of how that public-private partnership can work really well together. It is probably one of the most successful federal programs in allowing access to pharmacies and pharmaceuticals for our seniors. It is the most efficient program. Over the last 10 years, premiums have gone up only about $3, while we've encouraged the use of generics and provided extended care for seniors. So I think that program, as well as, again, the assets that we bring and some other companies bring in healthcare, really that public-private partnership.
Just how international is CVS and Aetna now? Would it be?
So CVS has a small operation in Brazil. Aetna has a larger presence internationally, and it's primarily focused on what's called the expat population. So both for companies who have U.S. operations and employees go overseas, provides coverage to them and access to healthcare in those markets, but then also brings them access back here when they come to the U.S. So, that's
So what does it mean when you can get medicine at one price in Detroit and Windsor at another cost? I mean, how are we reconciling the medical cost question?
Well, the whole medical cost, I mean, it is really very much locally determined based off of hospital networks, doctor networks, and other things. If you look at kind of the model that we're going to be building, we are going to leverage off of those local models, but then also push care into lower cost sites of care. So emergency room visits, for example, big consumption of healthcare dollars. Probably 30–40% of emergency room visits are unnecessary.
Well, why is medicine so much cheaper, say, in Canada than here? Same medicine, generic medicine.
Yeah, it's a great question, Reverend. There are a lot of factors associated with that. Obviously, the price control environment in some of those markets can drive that. But what we've done and what we've seen in the studies we do, the actual net price in many categories that patients here in the U.S. are paying is lower than even those price control markets that you see overseas.
You talk about, we were up after we had met in Rhode Island, a lot on your health hubs.
Yeah.
Explain the hub.
Sure. So the hub concept is really looking at care in the community and locally. And it's kind of resetting our pharmacies to be a greater access point for care. And I'd encourage you, we're bringing it to life. We have 3 pilot hubs up and running in the Houston market right now. And if you Google, not now, but just make a note of it, Google CNBC and Bertha Coombs and her coverage of the health hubs last week. What we're bringing in is really looking at things like blood draws, greater access to primary care and extension of primary care through Minute Clinic. Looking at, for example, having a dietitian there for folks who may be pre-diabetic or actually suffering from diabetes. Folks who are suffering from breathing and respiratory ailments, we have a respiratory technician there. So it's really putting care where it's going to be accessible.
One-stop shop.
One-stop shopping, exactly, yeah. But again, connected to the broader healthcare system, not a replacement, an extension of the primary care doctor and the hospital systems.
Recently you announced you're building a $100 million investment in building healthy communities.
Yeah.
And we're very ill. We'll take 10% of that. I'm sweating right now. I got high fever.
I turn it over to David, right? David's starting to sweat now. But that initiative we announced several weeks ago. It builds off of the commitment that both CVS and Aetna had in communities, and it is called Building Healthier Communities. So Aetna had a partnership with U.S. News and World Report, and you know how U.S. News and World Report, they rank schools, they rank other sort of businesses, et cetera. They are now going to be ranking communities on key healthcare access and other points, and point out why some communities are better than others and what differentiates them, and provide those learnings to bring them to other communities so we provide better access. And we're going to donate $100 million over the next 5 years to support that initiative at the local level.
In these inner cities and rural areas, you have the issue of transportation and homelessness and poverty. Are you shying away from building stores in those areas?
No, not at all. In fact, we were talking earlier, there's an interesting statistic just on folks for laboratory tests that doctors order. Roughly about 30–40% of the ordered lab tests aren't done. Why? Because most of the time, those facilities where you have blood draws done are only open during working hours. So if you have to take time off from work and you don't get paid, you're probably not going to go. It may be 2 or 3 bus stops, or it may be 2 bus routes for you to find where that facility is. So our concept is to bring some of these things into where CVS is, because it's in the community, it's part of your behavior pattern today. And what we're hoping we'll see is actual better compliance and adherence to what the doctors are ordering by having that care locally available.
The prevalence of chronic diseases, you have in the hub, are you addressing that?
Absolutely. So significant amount, probably 80+% of current medical spend is in things like diabetes, conditions like diabetes, cardiovascular, and other conditions. And pharmacy is the front line of defense for many of these conditions. So in the health hubs themselves, both through our nurse practitioners as well as through the care counselors that are there, we feel we can better drive adherence, identify conditions that may have not been identified previously before. And what we know is when a diabetes patient is compliant with their medicines, not only they're healthier, they're saving the community, the healthcare community, $42,000 to $5,000 a year. So investing in these types of services at the community level can make a real difference for the patient, but also for the healthcare system.
Well, if I took you to the University of Chicago right now, I would show you people who have these breathing problems and have the oxygen on. Just outside the door, they're being pushed down the street with the tent loose, smoking, and the person pushing them smoking. How do you have that?
Well,
Is that like they have a smoke station for workers who are pushing patients around who put the oxygen masks up the smoke. So.
Well, you touch on an issue that's obviously very central to our sort of mission. You know, we made the announcement several years ago that we're going to stop selling tobacco products. And it was a big step for us as a healthcare company to become a healthcare company. And what's really interesting is the impact it's had in the communities in terms of how smoking rates have declined in those communities where CVS is and the lack of availability of tobacco products. And we just didn't pull the products out. We've been providing smoking cessation, counseling, and other services to help folks who may be smoking to quit. And it's a journey, and we feel that investment has been very successful in that regard.
What impact has free screenings had upon your business?
So we have a program called Project Health, where we go into the communities, and we actually have it set up today, I believe, for folks to do it, where we provide screening on, blood pressure, some of the key body mass index, body weight and mass index, and other things. We've done roughly about 1.7 million folks, I think, have received these free screenings through CVS. They've made a huge difference. And what's most important is roughly 85% of folks who do these screenings at our Project Health initiated events, 85% of them follow up with either a primary care physician or the clinics in their area. And we make sure we tell folks who the primary care docs in that area, as well as the clinics that are available to provide care. So it's a real extension in the community to letting people know, but also getting on track to manage their health. And that's what the initiative is all about.
For example, Tom, how are you handling the opioid epidemic?
It's been a huge issue. Obviously, it's in pretty much every community across the state. I spent a lot of time at the state levels, and if you go back 5-6 years, they would have a heat map, Reverend, of where there were problems around opioids and overdoses. And the maps were relatively, thin, I would say. You fast forward to today, every state, that heat map is almost a solid red color across the entire country. And so when you look at the amount of overdoses and deaths that's happening, so at CVS, we have cut our dispensing of opioids by almost 40% over the last 4 years. And we do that through a bunch of different things, working with doctors, working with patients, working with what we call naive opioid patients, folks who have not been on an opioid before, counseling them ahead of time about the addictive nature of these products, as well as limiting their first fills to 7 days or less, consistent with what the CDC has recommended. But we haven't stopped there. They're in the medicine cabinets. Dentists and doctors have prescribed them. You don't use them, they sit there. Children are first exposed 72% of the time from their parents' medicine cabinet, a neighbor's, or their grandparents. We have to get those products out of the medicine cabinet and disposed of in an environmentally sensitive way. And so we now have disposal units in roughly 2,000 of our pharmacies. We've donated several thousand to law enforcement across the country. And in the last 2 to 3 years, over 300 metric tons of pharmaceuticals have been disposed of because of these initiatives. Now, we're not the only company doing this, but we have to reduce prescribing and get them out of the medicine cabinets and stop the children from accessing them, because that's where addiction starts.
The business of healthcare. I mean, we talked about your procurement, things you procure. Someone has to build the 10,000 stores and maintain them and secure them and get products and goods and services. Where do you stand on your procurement budget relative to I access you as a business partner?
Sure. So one of the things we're very proud of is we're part of the $1 billion club in terms of diverse suppliers across our business. We do roughly about $2 billion a year of business with diverse suppliers, 3,200 small and diverse suppliers across the board. And we impact roughly about $5.1 billion worth of spend as a result of that. And we're sustaining, we estimate through our analysis, about 32,000 jobs as a result of this initiative. And we're not going to stop there. It's a focus for us. David Casey, who I referenced before, he's hosting a session this morning on our efforts and the importance of that in building diverse suppliers, but also representing in the community everyone so that there's economic opportunity associated with our activities.
How many of you would like to do business with CVS Aetna, based on what product you have? Quickly, what do you have?
Water purification and treatment.
Speak up. Water pur.
My name is Peter Kennedy. I'm a water treatment and purification industry executive. However, my interest is, you mentioned something about getting rid of these metric tons of pharmaceuticals. In the community that I live in, we have an issue with pharmaceuticals going down the drain.
Yeah.
And as one of the members of our Metropolitan Sanitary District, we're concerned about that. And so we're telling the community to take those pharmaceuticals to the police station. Thank you. To get rid of those pharmaceuticals. However, the police stations now are no longer taking them, so we're now looking at taking those pharmaceuticals to the drugstores and seeing where they go. Could you tell us what happens when CVS does that?
Sure. So we have two programs. First, and we should talk about local law enforcement because we have a grant program where we actually donate disposal units to law enforcement. All you have to do, it's a one-page application, fill it out, and we've worked very closely with the sheriffs and police departments across the country in that regard. And then at our pharmacies themselves, they're not everywhere because of the DEA regulations around this. They're largely in our 24-hour pharmacies because they have to be, the disposal unit has to be in line of sight of the pharmacist. And if the pharmacist is not working, they have to be locked down and shut. They can't be accessed. So we started at 24-hour pharmacies. We are going to be in roughly about 3,000 by the end of this year. And what we do there is we have a nationally certified EPA disposal company. And it works all according to regulations. So when the unit is filled, it shuts, they come in, collect it, and then it goes to an approved facility where it's likely being burned and disposed of in that regard. Similarly with the police departments, they use their own disposal according to the state regs. But again, it's been a very successful program. We've worked hand in hand with both the police departments and sheriffs, but also with the state attorneys general across the country. So we should follow up after as to where you are and what facilities and pharmacies we have there.
Water purification, right?
No, that was my principal.
Yeah.
Yeah.
Well, I want to answer two or three, just state your name and what your product or your service is. I'm trying to, and where you're from. All right, sir.
Hey, good morning. Fran Westbrook's Boulevard Content as a multicultural ad agency. First of all, thank you for getting the cigarettes out of our community. I know that's a cost. It's $1 billion business. My question to you is, what replaces that now?
Sure. It's a great question. It was roughly about $2 billion worth of revenue. This was back in 2014. And obviously, it was a fairly sizable, profit stream. But we made the decision because, A, it was the right thing to do. We couldn't be a healthcare company selling these types of products. And what we have seen is the loyalty from customers has increased. It's hard to track, one-to-one, but reputationally it's been very, very important. The programs we were running around smoking cessation, counseling and the like, and then just simply other things that we can sell through it, healthier foods, healthier diet-related things, and that's where the health hubs. If you look how we're doing there, it's all about focusing on chronic and complex conditions, and what do you need as a patient to get to a better outcome and have a better life, and that's kind of how we're building our model going forward.
Tom, what about construction and architects? Because what you build basically is within our zone of capacity.
Sure, and so we put up a number of pharmacies each and every year. We have, as part of our supplier initiative, working with diverse and smaller businesses to get actually into that construction-related activity. But it doesn't stop there. It's across the board, across all the activities we do as a company, whether it's in inventory management, logistics, other things. All of that is part of our supplier initiative.
NPA. I'm sorry.
Hi, my name is Steve Hightower, President of Hightowers Petroleum Company and HP Energy. We're in the energy services business, providing fuel solutions. If you have over-the-road fleet cards and/or bulk fueling for your vehicles and your salespeople out on the road, as well as energy efficiency. So in your facilities, looking at lighting, building management systems, and other ways to decrease energy within your facilities.
Great.
Okay.
Good.
So, complete.
All of that is relevant. I mean, David, I'm sure we'll touch on that in the next session. Yeah.
The reason I want to give your name quickly and where you're operating from, because David Sand. David's one of the operational persons. I mean, a good, solid person. We have blockers and we have those who access. This access man. If he's a block, I'd call him out right now. David has the creativity and the authority to make decisions. So be sure to get Dave. When Tom will go on back to the country club, yes, ma'am.
Good morning,
Good
Endora
morning.
Govan. I offer caregiving and chronic disease strategies for seniors and elders with disabilities in the community. So we use a lot of services from CVS. We have stores, well, y'all have stores that perforate pills. So if someone is on 8 to 10 medications
yeah.
and all of that. And just in the areas where there's not a lot of access to the hospitals, we provide how people in the community can utilize CVS and the services.
Okay. All right, great.
Back NPA.
Good morning. Clifford Swint from MFR Securities. I'm proud to say that we're one of the 6 diversity-owned banks that assisted CVS during the $40 billion financing of that acquisition with Aetna. And so for that, on behalf of the whole Diversity Community Bank, I just want to thank you for that.
Well, thank you. Thank you.
And again, I know David was a very instrumental part of that selection team, and again, want to extend that thanks to
Great.
David as well. One of my questions, I thought we were doing questions.
Well, and let me just point out in terms of the financing.
What's your question?
Make his point.
No, it was just more a general question about how the footprint of your stores may change to accommodate
Sure.
the different clinics and things that you're talking about.
Yeah.
What could we expect to see
Sure.
in the new
Yeah.
CVS?
Did that connect at all with the
health hubs.
hub concept in
Yeah.
terms of?
So conceptually and strategically, the way that will work is not every pharmacy across the country will have a health hub. It will be a hub and spoke type model, and we are working through that in terms of where the hubs will be and how the spokes will work. But what we're learning is that even though it may be quote unquote a spoke pharmacy, there's an awful lot that can be done in terms of our current capabilities just by feeding the existing infrastructure. So everyone doesn't need to be a hub. It can in fact work very efficiently by just having certain services there, and then if you need more, you go into a hub, and that's the strategy we're building. Yeah.
Often when we hear about a new store is coming, the contract has been let, we want to be able to build on the front side. Access to compete on the front side.
Yes.
Is David the go-to person? Who's the
He
go-to
is.
person?
David's the go-to person.
Okay, David.
He's going to be busy.
All righty. Good morning. My name is Mario Gage, and I'm joined by my colleague Ayana Orr, and we're both with Ariel Investments out of Chicago, and we are a Chicago headquartered money management firm. And so we manage money for both institutional clients such as yourselves who would love to manage your money. We also manage money for individual investors too. So it's always a pleasure to be here at the Push Wall Street conference.
Great. Thank
And
you.
thank
That's
you
a
for
good
being
Good
here.
observation. Yes, sir, Mr. NMPA.
Good morning. I'm Stephen Larkin. I bring you greetings on behalf of Mrs. Dorothy R. Lavelle, Chairman of the National Newspaper Publishers Association, along with Dr. Benjamin F. Chavis. I work with the Black Press of America. What's your name, sir?
I'm Tom Moriarty.
Tom
Moriarty,
Moriarty. Pleasure meeting you.
nice to see you.
The NNPA, which is the only trade association which represents 200 black newspapers in America, we reach 20 million African Americans each week. We have been to Woonsocket, Rhode Island. We have met with representatives, senior representatives of CVS Health. First, I want to say thank you to Reverend Jackson. Last year, I met Tracy Smith, who's the senior vice president for CVS, who put us in the loop to get where we are now. Now, that's been over a year ago. Where we are now is we are trying to do business with CVS. We are the Black Press of America. Read surveys, 45% of people would consider going to your walk-in clinics. 55% say they're not gonna go.
Mm.
Now, we are in communities throughout America. What we like to do is a health and wellness program, not advertising, so to say, just to get people to come into your stores. It's a mindset. 9% with insurance say they will come to your stores. Now, we have the trust of the community. Did you say $2 billion, B with a B, that you're spending with African Americans?
Yes,
With a B?
yes.
Let's think about this. According to your senior manager, told me that it will probably be the second quarter of this year. This was back in November. Almost takes me back to a knock at the midnight hour, as Dr. King said. You have to keep trying. When that guy went to that door, the question is, what do we have to do? The black media, what do we have to do to work with CVS so somebody will call me back? Now, I've met senior officials. I was looking to see Larry Moeller. We ready to go to work with you. What do we have to do business with you?
That's it.
Well, let's follow up, and Mary's going to follow up with us as well. So Mary and David are with me today because this question goes specifically to Mary's area, and frankly, my area. I control communications as part of my responsibilities. So, yeah, perfect. All right.
The exclamation point goes straight down, the question mark, the one with the hook. Deal with the hook.
Good morning. My name is Michael Powell. The name of my company is The Cyber Group. So we're in cybersecurity, and I'm out of Chicago. So my question is, with the merger of CVS and Aetna, what controls do you have in place? So what additional eyes are you going to put on the merger, the Internet of Things, HIPAA, and those type of compliance issues that you will face? And was wondering with whom I would need to engage with to get engaged with your company in that service.
Yeah. Well, in terms of engagement, it's David. In terms of what we're doing, and actually we spoke about this earlier in our pre-meeting, is the whole advent now of video access and video healthcare and all the protections and securities that need to go around that. That's clearly going to be a focus. And obviously looking at data governance and data management. We want to ensure that whatever information we have is at your permission, is being used according to your desires and your needs, and then that we're protecting it both from a HIPAA perspective, but also obviously from cybersecurity and other related data protection. So it's a core focus, and again, David's the right person to talk to.
Well, what other product or service that you render you'd like to engage with CVS Aetna with? Who else? The reason I raised that question is that I was saying to Tom earlier today, some years ago when we first got started, we did a $6 billion debt offering with, at that time, AT&T. You were part of that meeting. And they were determined to get one company could do $1 billion deal, in which Blaylock got the deal. And then the next week, GE did a $13 billion. We were not in it at all, so we raised hell about it, met with them. And they did a This Is GE's World session. And they make everything from coffee pots to bombs, everything in every place. And so we were astonished at what all they do. They were astonished at what all we can do as suppliers. So I'm trying to do a hookup between what you have to offer and what CVS needs, so we can. The good thing about CVS is they're accessible. As big as they are accessible. And access is a big deal to us. So if before we close this session out, if maybe you have a product, a good, or service that you want to be dealt with, indicate your name and your product, and we'll talk about it. David, you have a workshop, don't you?
What's that? Yes, right after this, we'll have a supplier diversity workshop, so feel free to pop in there and I'll get your information.
What will the supplier diversity workshop be?
Riverside Ballroom. We're going to be in the Riverside Ballroom. Yes, sir.
Supplier. In other words, in that session, everything from water purification, Peter, to architect, to building, to marketing, advertising, a whole range of stuff they do. And they're willing to do that with us, and that's why we wanted them to be here today as a partner in the process. I want to express my thanks to you, Tom, for being here today, and wish Larry could have been here, but Larry had,
Oh, that's right.
yeah. Oh, where's Larry has video?
Yeah, we filmed the video. So Larry, unfortunately, was stuck. He could not get in last night because of the weather here. And then when the weather here cleared, the weather in Rhode Island wouldn't allow him to take off. So we were kind of stuck. But we have the video of Larry.
Hello, everyone. I am very sorry I'm not able to join Reverend Jackson and all of you today due to the inclement weather, but I am certainly with you in spirit. And it is an honor for all of us at CVS Health to join Rainbow Push at this year's Wall Street Project Economic Summit. Addressing the country's most pressing healthcare challenges, it requires the very best our company has to offer. And we have found that true innovation is enhanced when we seek out and include the diverse experiences and ideas of our customers, our communities, and our colleagues. Going forward, as an integrated healthcare company, we are committed to making even greater strides in building and sustaining a diverse and inclusive culture to deliver on our purpose of helping people on their path to better health. So in my absence, I can't think of a better representative to share our message with you than our Chief Policy and External Affairs Officer and General Counsel, Tom Moriarty. So thank you again for your understanding, and thank you for everything that you do to drive positive social change.
Thank you. Anytime you see a major white man with a mustache, or a black guy who went to white school who don't have a mustache, beware. Let us stand.